All right, good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 3rd of May. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Wachowski, whom I am a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics. In the United States, yesterday, we saw a very depressing number of 95,894 new positive cases. This is a 55% increase over the last 14 days, and the number of average cases is slowly creeping up. Dr. Murphy, if you remember, like 3 weeks ago, it was like 35,000 cases, and yesterday was 60,000 positive new cases with a 7-day average. Hospitalization and deaths are both having a slight increase, and in Illinois, yesterday, we saw 9,000 new positive cases. That cases are now up 66%. What can you tell us about this number that's like slowly creeping up in average cases?
Well, there should be really no surprise in that the mitigations have basically stopped in the United States. And so every time that has happened, the cases go up. The unfortunate thing is that the number of cases being reported are only the cases where a person had a PCR test or molecular test done in a certified laboratory. So all the home tests don't get counted. And there's a lot of home tests out there and a lot of people being diagnosed, at least initially, by the home test. So you might actually, unfortunately, have to multiply that 95,000 by a factor of 5 to 10. So there's a lot of cases. We knew that the Omicron was much more transmissible than Delta by a factor of 3 to 6. And then this BA2, yesterday I was reading a report that it had originally been said that it was 25% easier to transmit. Now they're saying it's 50%. So this thing is just super, super transmissible. And it's everywhere. The good news is that those hospitalization and deaths are still pretty low. And even though they're increasing at very small amounts. But that's something that has to be watched very closely. And cities like Philadelphia and other places around the world still have mitigations in place for indoor gatherings. The big music festival that was out in the West recently also was associated with a huge increase in numbers, and that was all outside. So this thing is very transmissible. So it's not over, which actually, maybe I'll bring it up now. Dr. Fauci was quoted as saying, this is the end of the pandemic part of this whole thing. But he was really talking about the end of the beginning, the explosive part of the pandemic. He has clarified his comments because it's caused a lot of concern, actually. So yes, we are not seeing 1 million cases a day, and we're not hospitalizing thousands more per day and people dying in the thousands per day. That is not happening, and it's unlikely to happen because we have a lot of different ways to treat this virus. We know how to take care of it better in the hospitals. We have oral therapies now. We have monoclonal antibodies. We have anti-inflammatory agents. We have all sorts of things that we can do with people that we didn't have at the beginning. But this is definitely not over.
This goes right into our big COVID headline, Dr. Murphy, and I know you mentioned this just now, but Omicron cases are spiking in the Coachella Valley after the music festival, even though this was outside. What does this mean for, the course of the pandemic if outside events are now causing such big spikes?
That's a really good point, Sophie. So when you see an outdoor event, when everybody knows that this pandemic is still going on, an outdoor event, everyone just outdoors, 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 and they're having it, it means that the virus is super transmissible, very similar to measles. You know, in California, when the measles, basically they got rid of the measles vaccine mandate, you know, because of anti-vaccine parents that were concerned that it was associated with autism, which it's not. As soon as they did that, they had 14 measles outbreaks in California, including one at Disneyland in Southern California, you know, which is primarily an outdoor amusement place. I mean, there are indoor rides too, but you know, that's a very transmissible virus. And this virus is getting very similar to that. It's getting almost as transmissible as measles, which is one of the most transmissible viruses known to man. So it's just telling you how transmissible this whole thing is.
Yeah, no, absolutely. Now for our big second COVID headline, China is obsessed with disinfecting against COVID, but is it causing more harm than good? What can you tell us about China's steps to disinfect in the streets, etc.?
It's a really good question because it brings up how complicated this whole thing is. And when you get something and it goes back to what we were just talking about hypertransmissibility of this version of the virus. The total lockdown approach that China has is not going to work. It's just too transmissible. Every time they lock a city, Shanghai, with 25 million people. When you lock that many people down, you know, you're basically, it's not working. You know, they're going to be locked down half the time. They're going to slow their whole economy down. What China needs is a more balanced policy, and they need better vaccines. That's really what they need. Their vaccines are not very good, and they need to vaccinate, you know, their whole population, and they've got to use other mitigation measures rather than this total lockdown. And their approach actually involves all this sterilization. They have these people with machines that are sterilizing everything, and it's probably not necessary. They're probably wasting their time with that. So they need to take a different tack. Australia had the same thing. And as soon as they got into a more more practical approach, they had a big spike in cases, but they had vaccinated almost everybody. I think their vaccination rate was close to 90%. So, you know, they didn't have that big problem with the hospitals and with the deaths. I think this is the way to go. So, you know, they need better vaccines, more vaccines, booster vaccines, and more focus just on other mitigations other than total lockdown. That's what's happening.
And that's a really interesting point, and goes right into, you know, what steps we should be taking for the next headline, which is that the U.S. should prepare for predictable southern summer surge, according to Birx, which is a COVID expert. What can you tell us about some mitigations that we should be taking in the United States to prevent this summer southern surge?
Well, first of all, I don't know why anybody is listening to Debbie Birx.
Okay.
You know, the former White House advisor.
Mm-hmm.
I mean, she's a disgraced and discredited expert who was an enabler of some very crazy beliefs put out by the last administration. Sorry about that, she took that turn. So I don't know why anyone's listening to her. But, you know, what it means is you've got to use all the different things at your disposal to stop these outbreaks. Right. That part is fine. And I was just talking about all the different things that you can utilize to keep the cases down, and to keep the people out of the hospital and to keep the people alive. As you know, reported just in the last week, you know, the number of deaths is now more in elderly at-risk people including those who are vaccinated, than the unvaccinated. It used to almost all unvaccinated people, almost like 10 to 1, the unvaccinated. This is not the case anymore. A lot of those unvaccinated people got Omicron. They have a little bit of immunity. So they've got some protection from that right now. And the people that are dying are the fragile ones that can't maintain the immunity to the virus because of their age and underlying conditions. So there's been an evolution of the pandemic and into this elderly high risk group.
Right. No, absolutely. And now for our last big COVID headline, the FDA sets aside June for potential decision on vaccines for youngest Americans. What can you tell us about this date of June 8th that the FDA has now set in stone?
Well, the problem in a pandemic is you really have to vaccinate everybody, or as soon as they can take a vaccine. If you don't do that, it's just you're going to have that unvaccinated group, in this case, children under 5, are going to be the drivers of the pandemic. Even if they don't get sick, even if very few of them die, but how many pediatric deaths gets a person upset? So in 2021, it turns out there were 393 deaths in children less than 15 years of age. So not even the older teenagers. That's a lot of deaths for kids. Kids just aren't normally, they're sturdy, they're protected, they get all sorts of other vaccines that help them save their lives. We're still having about 400 people die, but they're also, in the case of COVID, they're spreading the disease to other people.
Yeah, no, absolutely. And then now for our COVID questions, and our only COVID question, which is COVID the leading cause of death in the USA?
Yeah. COVID is not the leading cause, even though it has killed 1 million people, which is, quite a milestone. It took 2 years to do that. And for the last 2 years, the CDC estimates have come out that COVID is the 3rd leading cause of death. Heart disease, of course, is number 1. Cancer is number 2. And then COVID is number 3. And if you look at the total number of deaths, which is approximately 3.4 million deaths totally in the United States last year, very similar to the year before, 2020. People say, well, people are going to die from they may have COVID when they came in to die for something else. Yes, all that's true. But the number of deaths in the United States has been very stable for the last 10 years until COVID came around. There were approximately 2.8 million deaths per year. And now we have 3.4 million deaths per year.
Right.
And so that increase there, it didn't come from nowhere. I hate to use bad English there to describe it, but it's due to something that wasn't there before. Now, people during the pandemic also didn't take care of themselves as well. It was difficult to have screening mammograms or colonoscopies and other things to keep themselves healthy and to stay alive. So you had also an increase in the number of deaths from non-COVID related factors just because of the whole disruption in the medical care in the United States and elsewhere in the world. So we've got to be diligent and keep up with all that stuff. And, let's hope for a better 2022.
Yeah, absolutely. And that's a great way to close off our segment for today. So thank you, Dr. Murphy.
Okay. Well, thank you, Sophie, Kristen.
And stop.